the mouth is the gateway to the body. And we know that we just came out from the festive. We're still in the festive mood because still the beginning of the year, a lot of rice and chicken and all of that. But hey, you need to take care of your teeth. And so Dr. Adeola Abolarinwa has a lot of things we need to know about caring for our teeth.
It's in stages and phases of development. So you have the children, you have infants, children, preteens, adults, and then the elderly. For per phase and per stage of development, you look out for different things. Like for children or for babies, sometimes some babies are born with teeth. We call them prenatal dentition. It doesn't mean anything is wrong, and it doesn't mean that the gods or the ancestors are back. It's just like hyperactivity of the cells that produce teeth. If they are not shaking, you leave them. If they are wobbly, a dentist can take them off, and then the baby is fine, and then the baby will grow and develop normally. If it's to the stage where they start producing baby teeth, sometimes it's a struggle brushing, getting their mouth clean. You also go to the dentist. The dentist will give you tips and tricks on how to get a child to cooperate for oral routine hygiene in the morning. Then as they get older, you have the issues of, especially for boys, playing rough, breaking, somebody gave somebody one blow, that type of thing. So there is fracture, a lot of fractures at that age. Or we've had a girl that said she thought she was Superman. She was playing with her brothers, and she came holding her 2 front teeth in her hand. So but now in this day and age, it's both girls and boys. So as they grow, when you get to 16, 18, you're talking about wisdom teeth. They start feeling pain at the back. We call it pericoronitis. It's the time for us to take like those big x-rays so that we can see how the tooth is, the lie and all. This is also the age where aesthetics, self-awareness, self-esteem, so they want to look better. This is the age where people are making fun, classmates are making fun of them. Puberty is also in the mix. So braces, orthodontic treatment. And then as we get older, ram meat, eseron, plantain chips. What are those culprits that we have? Things, very hard food. Tooth fractures are common, especially at the back where we chew. Or maybe beans in stone, you just bite on it. Yes, so we call them vertical root fractures. So this is the age where a lot of extractions take place. We have to be careful. Then when you get to the elderly, the teeth have worked for like 60 years. They start getting loose. They start having a disease of the gums. So even without extraction, sometimes the teeth fall off on their own. Yes, so routine care every 6 months will help to allay and prevent a lot of these issues we see per phase in life. I think the first thing is to look at your mouth as part of your body. I think a lot of times we diminish the importance of teeth and gums. Look at it as equally as important as your heart, your eyes, your liver, those big medical emergencies. When we start with that, or it's all in the mind, when we start with that mental reorientation, then the priority and importance you should get, they will get it. That's number one. Number two, can we stop home remedies and fix it? All those, we've heard stories. Battery water. Nigerians will use anything. If somebody just says it works, they will use it. Please. There are dental professionals. There are, PHCs, hospitals, private clinics. Just go and register your complaints. Those who are trained to tell you what is going on will tell you what is going on. They would advise. Usually those maybe alabukon, those kind of powders, they give temporary relief. When it comes back, it will come back with a vengeance. What you could have addressed at the dentist initially, you now have to pay extra for them to now address it because the condition has become worse. So yes, my fellow Nigerians, please. I know dentists are not cheap, please. So that we can smile and look nice and still keep up with our reputation of being the happiest people on earth. Please try to see your doctor once in a year at the least. They can tell you what is going on, and then you get the right kind of treatment. Okay, so I think being aware of where you are in life. Like for me now, at my age, I'm not doing plantain chips anymore. I'm not doing chin chin. I'm not doing esero. I'm not doing asun, because those little bones in asun can really cause problems. But if you are younger, you can get away with some things. Once you are getting to middle age and all, what I usually advise is intentional chewing. Don't chew and forget yourself. Because even something as small as bread that has hard crust can actually break something, because your teeth have been working for a long time. So you can't compare it to a younger person that the teeth are still, still new. Let me put it that way. So if I have 40-something-year-old teeth, dentition, and I'm competing with a 20-something-year-old to be dragging cow leg, we know what the resultant effect will be. So intentional chewing. Please do not chew bone to powder. I have patients that's their specialty. They will chew the bone until, please, crab, leave crab alone. Things like that. But just be intentional. Don't forget yourself. So it's also a training deficit. I know what number my registration number was when I graduated. The number of dental schools are considerably low in Nigeria. The number of graduates are lower, okay, compared to our medical colleagues. So there's already a default deficit of qualified personnel. We are there to service the secondary and tertiary healthcare centers and then private practice. Personally, I think that if the government introduced, we also have primary dental care as a policy, but for some reason it's not been able to get any traction. But if they introduce it as compulsory, like immunization, where you have your immunization requirements for a child that is born, if we also introduce it at that level, that would help. The population would also help in driving the need for it. And then maybe more dental schools can be set up and established to produce more graduates. And also, let's not forget that there is the Japa syndrome also going on. So we were already small. We are shrinking by the day. We are trying to encourage more people to come to the profession. We're also trying to let them see that it pays to study the course. Because you can't ask people to come into your profession and they cannot live off the wages or have a good quality of life. We can't be telling them service to humanity. Service to humanity doesn't pay bills, doesn't pay school fees, it doesn't pay rent. So if we can make that connection, that you would have a decent life if you come in, if you do XYZ, this is the trajectory to go. Yeah, I think we'll be able to get more people on board.
Thank you so much, Dr. Adeola Abolarinwa. She's the dental surgeon. And one of the things I caught from this interview is the fact that as you grow older, you need to take care of yourself. And she mentioned the fact that as you grow older, your teeth might not be as strong as they used to be when you were much younger. So you need to watch out the things you ate this year. Very, very important, so that you don't end up losing all your whole teeth. I don't know if that's possible, but you need to take care of yourself.